this is Douglas Schofield. I'm responding to our vulnerable populations thread for week 7, and this is just a response to the video simulation, and just giving my clinical judgment in regard to the simulation that I viewed. For one, the first question is, tell me where you saw caring exhibited in the scenario. Well, the first approach that the nurse had to the patient, she did not approach it in such a caring way, but the way she was explaining and teaching the patient on how to care for a baby, questioning the patient to validate that the patient was understanding what she was saying, but also she also discussed, after she left out of the room, she discussed some of her frustrations with her fellow colleague, but was just she was frustrated, but she was still in her frustrations where you could see that she wanted to care, but she just didn't know exactly how to approach and what other ideas or suggestions she would have as far as for follow-up. For question 2, tell me what behaviors you observed that were not caring. She did not show a lot of compassion. When the patient was responding to certain questions, she was not interested in engaging the patient further in regards to her trying to understand what the patient was feeling, and also why the patient was responding in such a way that where she was responding, especially when the patient told her she had nowhere to stay, and she was trying to validate that the patient understand in regards to how to care for the child, and the patient's that baby is cute. So the patient, she could have engaged that a little bit more so she can find other resources for the patient. And she did not show any authentic empathy for the patient as well. She was very rushed. She felt harried. She was not listening, and so those were all non-caring characteristics that she was displaying. How would I respond to this situation? When the patient was, the way she was responding to my questions and concerns, I would have brought in case management. I would have asked more open-ended questions and tried to get an understanding of what the patient meant in the way she was responding to certain questions. So I would have just been a little bit more engaging in trying to determine exactly what the patient needed. So just sit there, open and listening ear, and asking open-ended questions so I can have that patient to verbalize and to ventilate, to vent what she was feeling. Also, tell me about priorities in the scenario from the patient's and nurse's viewpoint. From the nurse's viewpoint, it was about teaching, it was about preparing the patient for discharge, and also she was saying there's other patients that were waiting to come up. So she was also interested in making sure that she had the room prepared for the next patient. In regards to the patient's point of view, the patient, she was addressing pain. She also was talking about some of her socioeconomic challenges, such as not having a place to live, and she did not really engage or find interest in learning about the proper way of caring for her baby. So I think she was just really worried about where she was going to go after she leave the hospital, and basically what type of care was she's going to provide to the baby. It didn't seem like that she wanted the baby to experience what she was experiencing. Tell me about resources. She could have offered case management. She could have also talked to the physician and brought in mental health. Could have also offered some substance abuse services, and also really with mental health, just to determine was the patient depressed, and just to ascertain what is the patient's thought processes at that time. How will you transfer what you learned to here into the practice setting? I think that every nurse should demonstrate compassion. In articles that I've read, compassion is really the door to help opening up exactly understanding what we need to put in place to care for our patients. And I think that taking that compassion, taking empathy, and also taking some of the values that Bon Secours tries to reinforce, and taking that to the practice setting, and not just going through the motion, but authentically embracing those concepts and applying that to the patient care, I think is crucial.